Welcome to Bournemouth University's Virtual Open Day and this talk on the BSc Honours and Masters programmes in Mental Health Nursing. My name is Sonia Chavanagam and I'm a lecturer on the Mental Health Nursing programme. I hope that you enjoy this talk and you decide to apply for one of our programmes. Mental health problems affect how we think, feel, behave and perceive. For example, a person experiencing mental health problems may act differently to what is considered the norm, verbalise unusual and or distressing thoughts and present with a very elevated or depressed mood. They may exhibit behaviours that put them at great risk and can be very vulnerable. Apart from people with an organic brain impairment such as dementia, there is no diagnostic test to diagnose a mental health problem. Assessment is based on a person's mood, behaviour, thoughts and perceptions, which makes diagnosis much more complex. Another complexity is a mental health diagnosis is quite subjective, unlike a physical health diagnosis. For example, if someone is diagnosed with TB, investigations and assessments will mean that the diagnosis will be confirmed and remain the same whoever assesses them, both in the UK and across the world. It will not be the same for a mental health problem, which are perceived and assessed differently both in the UK and in other countries. 1 in 4 people are thought to suffer from some form of mental health problem at some point in their lives. The conditions can range from stress, anxiety, depression, schizophrenia, eating disorders, substance misuse and dementia, to name a few. But it's important to remember that mental health problems do not occur in isolation. They can affect a person's physical health, and likewise 50% of people with a long-term physical health condition experience mental health problems. Mental health services have only really developed over the last 40 years. People with mental health problems were cared for within large asylums, usually located away from towns. But now we have a range of services located within the community, in hospitals and health centres. As a mental health nurse, you will be multi-skilled to manage your range of roles. You will be looking after people with mental health problems and working with them and their partners and families, providing care, support and education about their illness and how they can manage their symptoms. When they are very unwell, you will need to advocate on their behalf, ensuring that they receive the care they require and that their voice is heard. You will manage the care of your service users either in a ward environment or as part of a caseload in the community, but you will also manage the team working with you. You will collaborate and work with other health and social care professionals, but you may also collaborate with other organisations such as schools, colleges, police and charitable organisations. You will lead your team by being an effective manager and a role model, so leading by example. You will need to complete audits and research to ensure the care provided is evidence-based and the optimal care that can be given. Our focus in mental health nursing is not on illness, but on health and recovery. Recovery is seen as enabling a person to fulfil their potential, which may have altered since they became unwell. For some people, they may be unable to return to their previous employment due to the impact of their illness, or the fact that their job precipitated their illness due to the stress or trauma it evoked. Therefore, it is looking at what other skills they have or what educational support they require for alternative employment. Also, instead of looking what causes ill health, we need to look at what resources they utilise to maintain or improve their health, such as walking, exercise, friendships, or being able to return to work. The main mental health nursing skills are communication and interpersonal skills, developing a therapeutic relationship with the service user so they trust you and feel able to communicate their needs or concerns. Observation is also a key skill, being able to detect subtle changes in a person's mood and behaviour, which may indicate they're at risk of harming themselves or others. Being able to effectively assess, plan and implement and evaluate the care a service user requires from both a mental health and physical health perspective is imperative. Research has shown that people with disorders such as schizophrenia or bipolar affective disorder die 15 to 20 years earlier than people without these diagnoses. This is because of the effect of the illness on their lifestyle and dietary choices, and the impact of the medication on their physical health. They are more likely to die from cardiovascular disease than their mental health problem. So mental health nurses need to also have skills to provide a physical assessment and decide what further physical interventions are required. For example, when caring for people with dementia, you will also need to help with their personal care, washing and dressing, as well as their nutritional needs, helping them to feed themselves, and maybe providing wound care. However, you may also provide this care to somebody with anorexia nervosa or with severe depression being nursed on an acute inpatient ward. The Nursing and Midwifery Council standards have recognised that mental health nurses require more of these skills, and therefore this curriculum means you will be learning with adult and children's and young person student nurses. As well as preparing you to care for your service users, you also need to learn about being a manager and a leader and understand how policies are developed and implemented to improve care. In order to complete your assignments, you need to develop a range of study skills such as searching for relevant literature, understanding how to read and think critically and evaluate evidence. These skills are not only required as an undergraduate or postgraduate, but as a registered nurse to ensure effective and appropriate care is provided. Students graduating from the BSc and MSc programs will possess the relevant degree and also a professional qualification as a registered mental health nurse. We discussed some of the key skills on a previous slide, and the skills on this slide are also required in other fields of nursing. It is important to remember that many of the people we care for feel stigmatised and vulnerable and may find it difficult to trust you, so you require excellent communication skills, empathy and understanding in order to develop a therapeutic relationship with them which will aid their recovery. Mental health nursing is not an exact science. What treatment or intervention works for one person may not be as effective for someone else, and that makes it both complex but very interesting. It can be very distressing when someone is admitted to hospital detained under the Mental Health Act and they have no or limited insight into their condition. Our interventions as nurses, whether listening to a person's distress or teaching them cognitive behavioural techniques, will not show instant results, but will contribute to their recovery. As a mental health nurse, you will work in a range of settings. These may be in a specialist area such as mother and baby units or within an emergency department. As discussed earlier, you will possess a range of key skills and knowledge. Mental health nurses assess and or look after people wherever they present or whatever environment they receive their care. Adult nurses who wish to have a dual registration can do so via the 2-year Masters in Mental Health Nursing. There is no advanced standing available for this route. The full 2 years will need to be completed. You will study some of your units with the BSc programme. These are the units you will study on the MSc programme. As you will see, they were predominantly at level 7 with a few at levels 5 and 6. The focus of both the BSc and the MSc programme is to incorporate the Nursing and Midwifery Council standards of 2018 in the need to create a more autonomous nursing practitioner. You are allocated an academic advisor when you start at Bournemouth University, who will be a lecturer in the mental health nursing team. They will provide you with pastoral support that you require in your journey throughout your nursing programme with us. They will see you for one-to-one meetings to discuss your progress at least once a term or whenever you feel you need it. If you think you have an additional learning need, which may be dyslexia or a mental health condition, it is important to inform us as soon as possible to ensure you receive the correct support. Additionally, if when you start university you think you may have dyslexia, please contact the Additional Learning Needs team who will provide an assessment for you. You will need to incorporate sufficient practice and theory hours in line with the Nursing and Midwifery Council requirements. Hence, you have an extended academic year of 45 weeks. You will be placed in a mental health colleague cohort, be allocated mental health placements, and have an academic advisor from the mental health nursing team. Your theory units will be based in Bournemouth at the Lansdowne campus, and your placement circuits will be in one of these localities, which I will discuss later. Your programme is accredited by the Nursing and Midwifery Council. This is the programme plan for the Master's programme. The blue box indicate when you are studying at the university and the green when you're in the practice settings. Underneath the blue and green blocks are the theory units you will be studying. When in your practice placements, you will have a practice assessor and practice supervisor allocated who will support your learning. You will be a supernumerary learner. You will need to work shifts and be expected to be punctual and behave in a professional manner, the same as it's expected as a registered nurse. Whilst on placement, some students choose to live near their practice area to ensure they get to their shifts on time. Although it is not essential to drive, many students prefer it as it is easier to get to placements and return home after a late or night shift. However, as our placement localities are generally large, you may be expected to travel 40 miles one way to ensure you have a range of different healthcare experiences. There are 4 placement localities. We will discuss your preferred one at interview, but it cannot be guaranteed. If we offer you a place on one of our programmes, when you receive the offer letter, please check the locality you've been offered. If you are unhappy, you need to discuss with the admissions team immediately. It is very unlikely that we can change your locality once you have started your programme at Bournemouth University. This map shows the practice area we cover, within which are our 4 localities. These are the things that you need to consider, and students tell us that working out your finances is imperative. Do check the government website to check what funding is available for you. If you are moving into the area, you need to consider whether you wish to live near the university or near to your clinical area. It is important to also consider that this is a stressful course wherever you study it, whether it's at Bournemouth University or any other university, and therefore you need to maintain a good work-life balance. Here is our new home for the Faculty of Health and Social Sciences, which is the Bournemouth Gateway building. Thank you for listening to this talk. I hope that you found it informative and interesting, and that you would like to join us at Bournemouth University.